Sioux Lookout First Nations Health Authority, or SLFNHA, presents SLFNHA Radio Connect, building strong connections with communities by sharing who we are, how we can help, and the services we offer. Wiindamekewinan, Sioux Lookout First Nations Health Authority Gajgadig, Egochke Eskam SLFNHA Ijinkade, Miwa Kegunenan, Iwanun Kegunjwichi Guyagban, Ima Ishkunaganum Kazagabeshig, Egochke Iwanun SLFNHA Wiindamekewinan. Greetings. My name is Charles Mikas, and I will be your host today. I currently work in the Wiindamekewinan department at Sioux Lookout First Nation Health Authority. And I'm originally from Sandy Lake First Nation. I've been with the organization now for about 8 years. Bojo waje gadna hegama ngagaku gajma we ogama kegunenan iwenun akuzib mujgaunan imanike Sioux Lookout First Nations Health Authority. Welcome to today's program. We're excited to have Michael Kiiwetinoong, Director of Client Services at SLFNHA, and Karen Costello, Associate Director of Client Services at SLFNHA. They are here to speak about the programming and services at the 3 SLFNHA hostels in Sioux Lookout and how SLFNHA is continuously looking to improve services in Sioux Lookout for people traveling for medical appointments. Bonjour, Waje. Mawajaganumunan damini ma yawangaj ewi kaganunangaj Michael Kiiwetinoong, miawajin kazganiganskang ahingwed akuzio gabeshio gamgun, Jeremiah gabeshio gamug gajin kadeg basic, egwa Karen Costello gudagawajin kaz gawidan kimaj gewine ugomawaj, Sioux Lookout First Nation Health Authority. Egwa imoyawag ewi Wiindamekewinan anin mayam einanchwinanung iwe hinga akuzio gabeshio gamgung kaganwabans gadeg niwanun nissen aja yawanun. Egotske aninige tudamapan nawajge gunj munsewapan Kiiwetinoong councilaj ganaj maskiwaj.
Miigwech for having us today. I'm excited to be sharing with you all.
Miigwech magabi aushen nongum kagizgag mawad jikkendan chibitbad mutawanan nongum kagizgag.
Before we start, please let me know about yourself and your history with SLFNHA. Pinuma ego kadawin damoshnamna anin epij inanchwin ima ahinga SLFNHA yanchwin ego kaz niganskaman.
Hi, Charles. Thanks for having us. Just a little about myself. I've been with SLFNHA for about 6 years. I came on board the Client Services Department in about 2020, which is a department under Regional Services, which is overseen by Monica Heeman. I was originally hired as a manager in 2020 and accepted the role as director in 2024. Just as I was hired, COVID was beginning, so there was a lot going on at that time. Since then, I've met and worked with a lot of our clients from our communities along the way, making improvements and listening to their concerns. The great staff at the hostel sure has made the time fly by.
Wajia Charles, miigwech magabi ausyank, pangiwin damonanin, maza SLFNHA ngudosyake ndonjian kuyegutsman and stamgi production. Akusi wichiwewanan hima kasmotigadig miwe 2020. Egutas huwe department, miawe Wiindamekewinan regional services, awe wukama Monica Heeman. Giwdapinago manager hiwe jinankian 2020, egutas ngino dapinan pangigani spagima director 2024. Iwe tasmegwat pangamatan kian COVID ma ksiakusuan gi pedagse. Mawad tasmistahi kegunan gi 7 huemegwat, ego tasapinisin dasam, ngi pinagskawag minegi piwitan kimagwa machine hawan o gutakusi Kiiwetinoong kapun jiwat. Egipe kagwemen sahagwa, egotske egipe sendawagwa hiwenwan kama mamitnendam higuat. Ahawenog dasudan ki gimaga beshigom gong, Mawat Koya Kutudana, Miwe Apskan to Gazata Sake, Kainin Wiindamekewinan.
Hi, Charles. Thank you for having us today. My name is Karen Costello, the Associate Director for Client Services, and joined the team in 2020, along with Michael. We came on board when there was the pandemic, and I was situated at Hostel 1. We did provide community members isolation services during that time, so it was very busy. My history coming to SLFNHA is working in about 17 First Nation communities. I provided community wellness services and women wellness facilitating in many communities. And I also worked in Kingfisher Lake for 3 years doing a lab program with Shibugama. So my heart is connected to the nations and providing services for the community members. I'm very happy to see community members on a daily basis and familiar faces. I wish everybody the best and look forward to seeing you in the hostels. Miigwech.
Wajia Charles, Miigwech Magayaw Siang Nongum Gagizgag, Miezin Kazian Karen Costello, Egudas Associate Director, Ntinangas, Ima Hingutakuzik Wiindamekewinan. Gipuit Tanukimag, Hiwe 2020. Michael Magabidoxin Gewin Megwatch, Egodas mi Magagip Madan Megwat Ksjakuzon Magagipitagwak. Egoedin Stamgis Yasago, Basic Abeshugamek, Hostel 1. Egodas and Giwi Chairman with the Kiiwetinoong Aquaswatch. Miwet Papikis Wiichangador. Mawatki Kuchan Mentagon Humegwatch, Egogapi Ayanukian, Hue Magapitoxian SLFNHA, Nizoaso Sharp, Hawanogs Konaganagi Puitan Kimag, Egodas Hiwanon Gip Papikis Sag, Hawanog Hue Megwatch Jakuzon Kagiag with Kiiwetinoong. Egotskewet Hengismanchua dan Shaking Gipianki, Miwe the lab program, Hiwe we got just taken a Jomuskim Gout up and got then a great Safgaj which got taken Gipinan Kistamash Bogama. Egotas Mawats and the birthday, Menuan and Margaret Kiiwetinoong and Shenok, Kegomene Puichagua. Iwan no deseo no ane got smawat minenta ne wap magwawet Kiiwetinoong kapon chiwa tasugis ka nanda honda gna kenmak ego dasmi ena ko gna uyak hiwen chimnia watch ego kawap minawa himaga beshuga mukong miigwech.
Good day, everyone. My name is Dr. Lloyd Douglas, and I'm the public health physician here at the Sioux Lookout First Nations Health Authority. I want to talk to you about routine vaccinations. Our communities are strongest when we take care of each other, and that includes staying up to date with routine vaccination. Lately, diseases like measles are making a comeback in Ontario and in Manitoba and all across Canada. These illnesses spread fast, and without vaccines, they can cause serious complications, even death. But measles isn't the only concern. Other vaccine-preventable illnesses like whooping cough, mumps, or even certain types of meningitis can also threaten our health, especially for children, elders, and those with weaker immune systems. Routine immunizations help our bodies build protection before we're exposed. Vaccines are safe, tested, and free. Most are given during childhood, starting at 2 months, then continuing into school age. There are also important boosters for teens and adults, and if you missed any, it's never too late to catch up. Whether you're planning a trip, heading back to school, or just want peace of mind, now is the time to check your immunization records. Let's protect what matters most: children, elders, and your way of life. Talk to your healthcare provider or nursing station about routine immunizations. If you have questions, you can also email us at acwinfo@slfna.com. Protect our past, safeguard our future. Keep up with your routine vaccinations. This message is brought to you by the Sioux Lookout First Nations Health Authority.
That is great. Thank you so much for sharing. Can you please tell us about the Client Services Department and its role with SLFNHA and the communities they serve? Miwe maajugumuntawa niwe ka Wiindamekewinan anin meaminan huig anin etujgadiga mujgadiga an huig na hinga akuzio ka besio ka mugunan ka bembantsgadigin egotske aunog iskunuganan Kiiwetinoong council ga imagaz kaya batstuad kazga beswat.
So the Client Services Department supports SLFNHA by providing essential non-medical services, such as accommodations, meals, transportation, housekeeping, laundry, security, and client advocacy. Our team is dedicated to creating a culturally respectful home-away-from-home environment for community members traveling to Sioux Lookout for medical appointments. This is made possible through the commitment and hard work of our amazing employees. We operate 24/7 across 3 locations in Sioux Lookout. One's attached to Wiindamekewinan Hospital, and the other 2 are Sturgeon River Road across town. Currently, we are in the 2nd year of operating our medical transportation department in Thunder Bay and are exploring hostel options there as well as in Winnipeg.
Rakusiwe Wiichiwewan, Yima Wiichan SLFNHA. Mihmane ke eka mask kiwak Wiichiwewan tabskut. Kesinapawat, Kamichwat, Bemochikewanink, Kasinakewanink, Kasibiganikewanink, Kanawenemuewanink, Mina Utakusi Ukanrutsketamagoning. Dan Kinagan Nanag mi ekagwetutamwa Chansniwa Gentagwach Umages Gapeshi Kuik. When wag Utakusik Kapisawat Wanawangag Maskiunon Kapentawap Mawat. Egutas miwega no jisek, hawano kapakitin tiswat minapit kakchen kiwat dan kinagan nanak. Egutas nimpimo tomen nissen kabeshi gambukong uma wanawangag, bezukima akusi gambukong count to sucksink, egomina nishin kutagyan hima Sturgeon River Road, as ataken. Egot hueme goch, miasa nishak iwene motoank, akusio pemotgeon, miwet penesiwajang, egot smegot nantonamen, kapesio gamik gegi sinagwakaban way to Winnipeg.
That's amazing. I'm so glad to see SLFNHA expanding client services into Thunder Bay and Winnipeg. This will be great for clients across Kiiwetinoong. What are some of the highlights you've encountered this year at the hostels? Miwe maajugumuntawan. Iwe anin ekogwe istiganong imahinga SLFNHA ketnaj nadajisga beswaj awenug kabnaj maskiunuewat. Ahinga Thunder Bay Penesiwajang egotske hing Winnipeg. Miwe maajugu tamunsewag Kiiwetinoong aunsewaj awenuga kabnado maskiunuewat. Ego gadawin demosnamna iwenun kabye segen kab mamun segen iwenun iwenumga izudanang bezuyak ahing akuziuga beshugabu.
We've done many improvements over the past 3 years to our hostels. For example, we've supported communities affected by wildfires this summer by providing accommodations, especially for the prenatals and vulnerable community members. Thank you to the Safe Communities Department with approaches to community well-being and everyone involved in providing support in these situations. The Client Services Department also supported SLFNHA camp initiatives at Wiindamekewinan, such as the mental health and wellness camps that took place earlier this year, as well as the women's retreat and the men's retreat. We also provide advocacy on a daily basis. And if there is a client that requires any assistance, they are more than welcome to reach out to a client advocacy worker, a hostel support worker, or a patient navigator. If there are concerns with NIHB, travel, accommodations, or reimbursements, assistance that is required, they can also reach out to client advocacy, patient navigators, and hostel support. At Hostel 2, we have an activity room for the children so that they have a safe place to play. And it's a great area for elders if they'd like to come and create a puzzle or do some beading. We also have a sitting area for infants. And then a mother can sit down with their baby while their child plays.
As I'm Wiindamekewinan doon to Wiindamekewinan, who is Wiindamekewinan nissen gabeshu gamagont. Kiiwetinoong Giwichaman hawano kakipimatiahkasuach wenum kani benekeki minagata keskabeshwach hawano gdamawat kagekskawswach egamina kani namasuach. Gotas nui hunjiwach yema Diana Cots mimagayan kis approaches to community well-being department. Hegos ke kaknawi akiwen gagi wichiwewach huwen megwach gagi kchanm se keginon tuwedne kehi Ontario. Hego da sutako zin gawi chawach we department. Kaye okiwich tunawa huwen SLFNHA. Pekwatakin kapeshuan onaman zipi wetikagi and dawichin do mamit ne chigan menuawnink imawichiwanink kagi to the mat we nongam kagi nipink ego the skin give stomen dajikeugamik mi ma hostel 2 hawen wa getnat uniki gomak Wani Jan Swan himagesh wichitashike mawach.
Thanks again for that insight. The Client Services Department truly is helping our community members in times of need. What are some of the training that the Client Services Department offers to employees so they can grow within SLFNHA? Miyox migwech iwe Wiindamekewinan anin ginezib buabendaman. Egotske iwe akuzio gabesho gamgonen gaunj ganwaben zgading gaunj bumban zgading egotske anin kegwestga apen osmej gunj wichi apen hag ansnwag ansnabig Kiiwetinoong gaunj sewats egwa kegunenen eminda Awanog udanhuig gaunj wichi gwaj yuen udanhuinwa gadawin the most namna kegunenen yuenun.
Definitely. We've built a system to ensure that all employees of the Client Services Department have the opportunity to learn and grow within our department. Some of this training for our front-facing staff, including our security team, includes cultural sensitivity training, customer service training, and nonviolent intervention training. For staff, we also provide training in first aid, defensive driving training, food handling safety training. We want to ensure that all our team members feel comfortable and safe in their positions and that they are able to grow with us.
Kiiwetinoong Nagiwinatoman huaga stoa Kiiwetinoong kakana Wiindamekewinan ima utakusin kan koawach. Ima chanun te tausen ka wasmejik kendamat Wiindamekewinan. Ego tasnanda ka knohamang do magan en stamwapmen do Wiindamekewinan kaye awen wag okanawen tigek mina ansniwa te soen tiktendamwat kese wit chawat utakusin Ega chimiganat wichat utakusin. Ego gewen gize kroma goman kese wich hensutakusi nanda guy set Keesi kanawene mitisut miganich. Ego ke kwaya keesi asanget. Ego mina pehka chito utanukkiwin. Mitsuegaantu Wiindamekewinan sentan kinaganana kahkana. Se minomat stoat utanukkiwinwa. Se mina pehtagen muach. Ego mina chianne nesitawenda muach kahkana kaasi wichiwewach.
Wow, I am impressed. I heard that there is also a booklet which it illustrates the client journey and how SLFNHA is able to help every step of the way. Can you please explain more about that? Ega maujugu iwe muntawan iwe kegunan ga Wiindamekewinan. Ahi ami ge aya egi nundaman en maznega dig anin geistige en gispin nanandao benaj maskiun wain. Egustig noaj juenseg ban chikendamaj aunugu dahuzig angestigapan bemajad. Kada Wiindamekewinan kegunen iwenun kegunen iwegajgadig.
Absolutely. The Client Services Department has created a booklet that is reflective of a client's journey. It is called The Pathway to Care. This booklet is done with excellent imagery by local artists of the client beginning the journey from their homes in the north, attending appointments in Sioux, and completing their pathway back to returning home and community. This booklet is available at all 3 hostels for both clients and their escorts to read and take home.
Sidetago. Utakuziwi chigon ogewestonawa masnaganes miwe kaisina kwakutakuzi gazi bemuset michezn katek kani se pemme kanewenement utakuzi. Uwedas masnaganes miwe masnagaten eni zat hawe masnibige egoistut. Awen utakusin apinimagaun chmachach ogapeshon in Kiiwetinoong kaisat with one naungang maskiunong ganwap mach egomen apangani tapminoach kan Kiiwet. Wetas maznaganes atewan wetin nisan kabeshiu gamagon egot sawe utakusi. Jani kiwe utoch mina hawan wan ka bichu wan ugoch apinan kiwe watch.
That's really important. Thank you both for sharing about the Client Services Department at SLFNHA. Is there any upcoming news and plans to share with our listeners? Miwe kichimigwachugu kidinguna iwe gabuindameg iwe anquiun Maujuga extinendauch, egochke gegunen gegunen iwega anquion gab mujgadig, Wiindamekewinan, egochke aunuga gabzindamaj jigunchke damapan anin gestiaj gab majin jonda, maskiunwan gab biendawab maj. Egochke kudagian yawanun iwenun gegunen gab bien kwadamig, Wiindamekewinan na gegunen iwenun.
Thank you, Charles. The Client Services Department will continue to prioritize First Nations recruitment for all teams, as we're always looking to hire community members. You can find all job opportunities on our website, slfna.com/careers. Those can be found under the Client Services tabs. We are continuing to renovate the new dietary area at Hostel 3, and renovations at Hostel 1, we're improving the client rooms. These new rooms will have new climate controls and updated bathroom and flooring. For our upcoming winter season, we are planning more activities for the clients, such as skating at the rinks and other fun things planned by our activity coordinators. Looking forward to seeing everyone around. Feel free to stop by. Thank you.
Miguel Charles, Dakuchigui Chiguanan, Miwen again is Nigan Chikewach, and Sinikang Chigagwentawach and Kinaganan. Biomoz against Nananton again. Kimachka Gimkanawa and Kiunan Chegne Bigadegen SLFNHA with a good Chiganink. Mihueke me got and then what was Stomen Himagat as Wiindamekewinan, me with the Hostel 3. It was Kendan what was Stomen Hostel 1 Himagas Unibel Gamagua Utakuzik. Ego tas himaga zubustuang hiwe kisisgewen. Ego tas ke hing misi ugamegong mina hiwe motsagang. Ego tas we minoat ken pepong ke aistigewa hona gutakuzik dapskut mat helgamegong. Mina kutakian hiwenwan ke Wiindamekewinan mihaonog metawean kinag okemak mihaonog nanantu nanawach anuunatuach.
At Sioux Lookout First Nations Health Authority, we're committed to building strong, supportive teams, and we focus on hiring First Nation employees wherever possible. Whether you're just starting out or looking for a career change, SLFNHA offers competitive wages, comprehensive health benefits, a pension plan, and even fitness reimbursement. Visit www.slfna.com/careers to explore current opportunities. SLFNHA, health careers grow here.
So that concludes today's show. Thank you for tuning in to SLFNHA Radio Connect, where we are building strong connections with communities by sharing who we are, how we can help, and the services we offer. Connect with SLFNHA on our Facebook page or on our website at www.slfna.com. Miapanaguiwa at Dibseg Noom Imaga Wiindamekewinan Akwazio and Kuyun Gabmujgadig. Ima SLFNHA Radio Connect. Mawajibu aikad nanun isunganan suidan kumanda anshinwagega anshinadeg egotske anin gegizwichigueman iwa akhuzio ankun kabmujgadeg miga.
And produced at Wawatay Communications Society.